Hi, my name is Julie. I am a care management nurse for Signal Lamp. This company is amazing to work for. I've been here a little over a year. A lot of what I love about this company has to do with how interesting it remains, because there's always changes, and the changes are always for the good. The company is very pro-patient and pro-staff. I felt very welcomed when I started here. I continue to feel that way. They're very good about working with situational issues, as far as personal issues, as far as anything. As long as you're doing what you're supposed to be doing and, caring well for your patients, everything is good. I have never worked for a company that I have received the day off paid for my birthday, which is fantastic. I love that. Part of why I also love this company and this position, as far as working remotely at home versus like bedside care, I would say number one, obviously, I can work in my pajama bottoms, but I love the continuity that you get with the patients. Like, I have done triage, I've done, bedside care, I've done all kinds of stuff. But the bottom line is you don't really get the continuity. This way, we're checking up on our patients. We have a way of, continuing on checking on them if anything, goes awry. We have direct contact with the, physician's office. Things like that. It's really good. I really, really love the fact that I can get up in the morning, drink my coffee, and log on, and I'm at work. I love not having to commute, home. I love not having to worry about snow and things like that. But it's just a really great company to work for. The job itself is awesome. Love my patients. Love the company. The administration in this company is very good to work for. I have worked for numerous companies. Prior to becoming a nurse, I was unit secretary. So I've worked in many hospitals before and after nursing school, and it's just been a ride. I know, a lot of people know a lot about healthcare that have been in it in a while, but this company's different. They stand out just because of the way you're treated, the way they explain things. I will be honest, when I started, I thought, how are they going to train me remotely? But the training here was excellent. I realized that it was actually a little easier because everything, you watch some things, but most things are hands-on, you're actually doing, and that's how I learn. The trainers are very thorough. They give you plenty of time. They make you feel comfortable. They don't, rush you into something you're not comfortable with. So that was definitely a plus. Something I remember that really stands out as far as why I think this is a great program, the chronic care management program. For one instance, I can remember a patient that chased his dog. The dog got loose and he was short of breath, which, that's normal. 2 weeks later, he was still short of breath. And then he started complaining of chest pain. We had conversation upon conversation. I told him to go to the emergency room. He didn't want to go. He was very stubborn. Him and his wife were upset with me, but the bottom line is he went to the doctor's office because he didn't want to go to the ER. They sent him to the ER and he ended up with a quadruple bypass surgery. Here about 2 months ago, after not speaking to me for a while, I called them and he actually apologized and thanked me for saving him. He's like, I should have listened to you in the first place. He has done a 180 with his health. He is exercising and eating better and just taking his health more seriously. This was a guy that wouldn't even check his blood pressure because he thought it was annoying, but now he actually checks it every day. So, it's just those types of stories that really help us to know that we are doing a great service for patients. It's a really good company to work for, and they have this FPC chat that people were in there putting, different parts of information, like stuff that just helps us gain more services for patients, just a lot of information. But they chat, they talk about because we're from all over. We're not just from one state, we're from multiple states. And so it's kind of nice to we're having a snowstorm up here and somebody in Florida is enjoying 80-degree weather and it's sunny, so it's kind of neat just to see the diversity that's in this company. We have a few nurses that speak a second language and they help a lot of that population, which I think is pretty neat. If we need anything, there's a ticket system that we put in. If you have questions, you can reach out to the quality nurses. They're very good about getting back to you, especially in an emergent situation. They are always right there.